Hello. Today, we will be drawing relationships on the health inequities between Aboriginal and Torres Strait Islanders, ATSIs, and socially economically disadvantaged peoples, SEDs. Nature and extent of health inequities. For ATSIs in 2005, the life expectancy was 10 years lower than that of a non-Indigenous person for both females and males. In 2017, the life expectancy improved by 2 years, decreasing that gap between ATSIs and non-ATSIs. However, for SEDs, their life expectancy is 10 years lower than that of a non-SED, meaning their gap has not improved in the past 15 years. For ATSIs, the incarceration rate is 20% higher than that of their respective female and male non-ATSIs. On a similar note, there's a 72% chance that the incarcerated individuals are SEDs compared to 15% who are non-SEDs. For ATSIs, their education to complete Certificate 3 to Advanced Diploma since 2014 has significantly improved, with the gap decreasing from 10% to less than 5% in 2019. However, to complete a bachelor's degree, the disparity of more than 15% between ATSIs and non-ATSIs has relatively stayed the same since 2014. Similarly, SEDs are more likely to attain the highest school certificate at 69% than they are of achieving a bachelor's degree at 9%. Vice versa for non-SEDs, they are more likely to attain a bachelor's degree at 78% than they are of achieving the HSC at 8%. Health determinants. Sociocultural determinants include family. For both groups, their counterparts are twice as less likely to be involved in domestic violence. Peers. More apparent in SEDs, both groups had peer pressure as a significant contributor to the involvement of illicit drugs. Another reason for drug involvement is having lesser access to the media, meaning they lack the health literacy surrounding illicit drugs. Culture and religion aspects are far more apparent in ATSIs. When both groups have an inclusive community and strong identity with cultural ties, it improves academic performance. Socioeconomic determinants include the education level achieved by ATSIs and SEDs is more likely to be advanced diplomas from TAFE rather than a degree from university. This then justifies why unemployment for ATSIs and SEDs are significantly higher than their counterparts, with SEDs having a far more rapid increase than ATSIs. Consequently, income for both priority groups, more so for SEDs, live under the poverty line by $135. Environmental determinants include geographic location. If an individual is remote or very remote, it is more likely that this individual is homeless as an ATSI than as a SED. As a result, access to health services and technology is dependent on the proximity of a health institution, such as private and public hospitals, which offer immunization and cancer screening programs in order to decrease morbidity rates. Addressing health inequities. The role of the individual in addressing health inequities is to begin to focus on good decision-making and taking responsibility for personal health. It is made possible through things like the Brewery Bursary at St. Patrick's Strathfield or the Indigenous Scholarship at UOW University. These initiatives are intended for ATSIs and SEDs respectively so that they can develop personal skills and discourage risky behaviors such as smoking, drinking, and drug abuse. The role of communities in addressing health inequities is to ensure full participation of priority group members and empowering them to make protective behavioral decisions. Through the Heart Foundation and Diabetes Australia, who produced the Live Now and Have Hope booklet, protective behaviours are instilled in Aboriginal people to have a more healthy and better future in terms of diabetes. Practical support networks such as Will to Live have been organised by the Sisters of Charity to help homeless SEDs re-engage with society. The role of governments in addressing health inequities is to increase expenditure on education and health programs and address related social determinants through a range of preventative healthcare activities. Through the building of healthy public policy, availability of free or low-cost healthcare through Medicare and the Pharmaceuticals Benefit Scheme, or the Rudd government's apology speech have significantly improved cultural ties by slowly abolishing barriers between ATSIs and SEDs together and their counterparts. Extent, how, and why. It is to a great extent that health conditions experienced by ATSIs and SEDs are priorities to be considered when bridging the gap between them and their counterparts. Their health status is measured using epidemiology, which is the study of rates and patterns of illness, disease, and injury, and compared to an identifiable standard such as the health status of the general population. A predominant extent of the health status of ATSIs and SEDs are studied using primary statistical data of morbidity, mortality, infant mortality, and life expectancy. For example, ATSIs and SEDs' life expectancies are respectively 8 and 10 years lower than that of their counterparts. Then, to determine the burden of specific health trends imposed on the community, several factors are considered such as social justice principles, the prevalence of the condition, the potential for prevention and early intervention, and costs to the individual and community. For example, Medicare from the Australian government and Indigenous scholarships from UOW University both aim at honouring social justice principles of equity and supportive environments. However, the primary extent of the problem lies in the lack of funding dedicated to social justice principles of equity, diversity, and supportive environments by the Australian government. Dr. Jackie Huggins, the co-chair administrator for Close the Gap campaign, comments on how more investment is needed to train and support Indigenous health practitioners, doctors, and nurses. Hence, the reason it is crucial to prioritize those groups is due to the potential for prevention of many prevalent chronic diseases. For example, lung cancer and aged ATSIs have 500,000 more incidence cases than non-ATSIs. And SEDs have the most incidence rates of lung cancer compared to other cancers. Accordingly, preventing chronic diseases allows them to have an improvement in the quality of their life, sustain maintenance of social equity with the allocation of resources and funding, and reinforcement of community ties. Thank you, and have a good day.